Rural Health Month and to highlight the work of the Congressional Bipartisan Rural Health Caucus, which I am proud to co-sponsor with my colleague, Representative Takuda of Hawaii. Over 60 million hard-working, everyday Americans live in rural communities throughout the United States. And as my co-chair, Rep. Takuda, is fond of citing, with nearly 97% of our nation being designated as rural. Compared to their counterparts living in urban and suburban areas, rural Americans experience lower life expectancy, poorer health status, and more difficulty accessing quality and affordable health care. Rural patients face these challenges due to a limited number of rural health care providers and professionals, higher rates of uninsurance and underinsurance, and long journeys to care providers, sometimes lacking transportation entirely. Having served as a community pharmacist in East Tennessee, which is a rural area, for over 30 years, I understand the unique health care challenges and obstacles faced by our patients and health care providers each and every day. It's crucial that Congress takes actions to address the issues that rural health care providers grapple with, such as workforce shortages, supply scarcities, reimbursement challenges, limited access to telehealth, and difficulties ensuring their patients receive the care they need. The Congressional Bipartisan Rural Health Caucus is here to provide a forum for members of Congress to advocate for legislative action that will help increase access to quality, affordable health care and mental health services for all rural Americans. As co-chair, I will continue my work to advocate for legislation and policies that will ensure long-term sustainability of rural communities. Earlier this year, I introduced the Bipartisan Rural Physician Workforce Production Act, which improves Medicare reimbursements and enhances the current structure of the Medicare-funded graduate medical education program, bringing more medical residents and doctors to rural areas in need. I also work with my fellow colleagues from the Tennessee delegation to introduce the Rural American Health Corps Act, which would provide incentives for healthcare professionals to work in rural health facilities in exchange for forgiving medical student loans. In addition to these bills, I'm a proud co-sponsor of the Save Rural Hospitals Act, a bipartisan legislation that will aid in curbing hospital closures in rural communities by ensuring fairness in Medicare hospital payments. This legislative work is absolutely critical and complements House Resolution 870, which I introduced with the majority of the members of the Rural Health Caucus to support the goals and ideals of National Rural Health Day. National Rural Health Day, the third Thursday of each November, was established to honor rural communities and the contributions and efforts of rural health care providers to address the unique challenges faced by the patients they serve. Given the aforementioned healthcare disparities faced by rural Americans and the continued difficulty experienced by rural healthcare providers in keeping their doors open, it's vital that Congress prioritizes improved patient care and access in rural areas. Our rural healthcare professionals and patients showcase a selfless and community-minded spirit, and it is altogether fitting and proper that we celebrate rural healthcare providers and the millions of Americans that rural healthcare providers serve and express a commitment to advancing policy to improve healthcare accessibility and affordability in rural areas in our country. Mr. Speaker, I thank Representative Takuda and my colleagues for joining in this cause, and I yield the balance of my time.